Motown, the Motor City. Detroit's had its time on top, and now, with hard work and people who believed and never gave up, our time has come again. Because right now, in Detroit, it's revival time. Innovation time. Dinner time. Game time. Showtime. Move-in time. And now's the time to experience all the things you've heard about Detroit for yourself. It's time to see it, taste it, hear it, feel it, witness it, and believe it. This is Detroit, and we're here to tell you it's go time.
Hi, everyone. My name is Dawn Yargeau, and I want to welcome you to our webinar today on leading care through student-run free clinics. We have a number of students here that'll be here to answer some questions for you. We will ask you to put all the questions and comments in the chat. We will do our best to answer them throughout the series, and then toward the end, we'll have some time to do Q&A in the chat as well. Your microphones and cameras are automatically disabled, so unfortunately we can't see you, but we hope to see your questions in the chat, and we look forward. This will be recorded, and we will make it available to you as soon as it's transcribed. So I'm going to introduce you to Kristen Copenhaver. Kristen is our Director of Admissions at Wayne State University School of Medicine. Kristen?
Thank you, Dawn. Hello, everyone. Thanks so much for joining us today. Let me share my screen really quickly here. And before we get to the main portion of the event, we thought we would provide a brief introduction of the Wayne State University School of Medicine for those of you who aren't as familiar or who need a refresher. So let me fast forward here. We've been around a long time, nearly 160 years in the heart of Detroit. And we prepare students to go on to be the healthcare leaders and advocates who are dedicated to serving the underserved and going on to transform the promise of equal health into a reality for all. So our students have access to opportunities here in Detroit and are connected to huge networks of physicians, researchers, alumni, and leaders, and they are supported, connected, and successful. Here are some stats highlighting our students, specifically our class of 2027, who are now rising M2s. On the right side of the slide, you'll see additional stats, or excuse me, the left side of the slide, our students. So we had 305 students from 23 states and 90 plus colleges, representing 130 majors, in-state, out-of-state percentages, MCAT stats, GPA. Many, in fact, most of our students coming in are experienced with regard to community service, volunteering, research. They have lab experience. And then over on the right side of the slide, you'll see that a lot of stats and facts about who we are and what we do here in the heart of Detroit and Metro Southeast Michigan. We have 70 plus clinical sites. We have 13 student-run free clinics, which we'll be discussing more in depth with you today. We have 100 plus student organizations. Our students, again, are very involved in research. We have so many incredible researchers here. We're nationally ranked as a research institution, and pretty much anything and everything you're interested in pursuing or researching, we have people here who probably explore those areas. So we have a really vast alumni community network, 26,000 in that. We have a really diverse student body. We are really focused on supporting our students as they're coming in through graduation. So we have great teams of financial wellness advisors and so on to help our students out. And we have great stats and success rates. So we have a 98% match again in 2024. And we had students matching into 24 specialties in 30 states. So, and of course, our city, we saw that video on the front end of the presentation today. Just wanted to highlight, there's so much energy and excitement here in Detroit these days. And not only with regard to entertainment and culture and food and all of that, but certainly for our medical students, it's a really exciting, amazing place to be. We have access to Michigan's leading healthcare facilities. We're right next door to many, just on the street from many. Our students have access to diverse populations, cultures, and perspectives, which helps them go on to be incredibly compassionate, knowledgeable, and trained physicians. We have a lot of these webinars. I hope you're able to view our old ones on our site. You can go to med.wayne.edu/admissions and get links via our YouTube channel to old webinars. But pretty much a common theme when we do these with our faculty, alumni, and students, we hear often that they feel so well prepared and confident and well trained as they go into residencies or as they're in their clinical rotations, because they've had so many incredible experiences and learned so much here in Detroit at Wayne State School of Medicine. So let me go on one more slide. Of course, plus they get to experience all the energy and excitement that is Detroit. We had, of course, the NFL draft was here this year. The Lions did amazingly well this year. We're excited for next year with that. We had the Michigan Central Station just reopened. So there's a lot happening here and it's pretty exciting. But today we're here to talk in depth about our student-run free clinics. Here is a list of all of the free clinics that we have. Of course, it's a lot to dive deeply into in one presentation. So we have the opportunity to hear from some of our people who are much more involved in some of these. And so we'll highlight just a few. So I'm going to stop sharing my screen now. And Dawn, throw it back to you.
Well, we are going to introduce Dr. Jennifer Mendez. Dr. Mendez is responsible for all the activities and opportunities, particularly those with our student-run free clinics. So Dr. Mendez, can you share with us?
Thank you, Dawn. I appreciate the introduction, and I will be sharing a couple slides today to share more about what we are doing in our service learning program at Wayne State School of Medicine. I am trying to get it to go to there we go. All right. And my name is Jennifer Mendez. I have my email address there for you. Should you want to contact me and have questions, I would be happy to respond to them. We have a service learning program and we have a community engagement elective. I will go through that a little bit more with you in detail. As far as the service learning program goes, it is from birth to grave. So you can see everything in between there that we have been able to provide our students with opportunities. It does complement the mission of the School of Medicine. It is a local investment in Detroit, and the future physicians, which you will be, do get to see a diverse population of African American, Caucasian, Arab Americans, Hispanic, as well as Southeast Asian students that are part of our courses, as well as in the clinics, you will see patients. You engage in these clinics at either student-run clinics or community-driven events like health fairs. Some of the opportunities that you will have are connected directly with some of the chronic illnesses in Michigan, such as diabetes, hypertension, kidney disease, obesity, cardiovascular, COPD, and anxiety, which is very, very prevalent right now, having just gone through the pandemic. some of our students during the pandemic not only engaged with vaccinations of patients in the community, but were also using Zoom to educate patients that had to be in touch with their physicians and had never ever used Zoom before. So they created modules and allowed the physicians to be engaging with their patients, but it was due to the medical students. We have a falls prevention program that you can be doing with a patient in their home. We also have the opportunity for interprofessional education. And some of this is related to our electives, and you have an elective in year 1 and year 2. These are specifically addressing the agency needs in our community. The agency let us know what they are looking for, and our students then address those needs. Example, an agency might say, I want more information to be spread out about a fresh food. And our students are at the farmers markets. They're educating the individuals that come to shop out there. And this is, you saw in the video, Eastern Market. The students are also talking to these patients in other languages like Arabic, Spanish. You have an opportunity to learn the basic Arabic and Spanish terms so that you are able to interact with the patient, at least at the very first level, on how to even say hello. Some of the projects that we have created, if you click on this link, Digital Commons, it'll show you at least 10 to 15 on each activity related to the diseases that I just mentioned to you, cardiovascular, kidney disease. This one I am highlighting for you was about alkaline water. It was created by our students as part of the time that we were in the pandemic and people needed to know more about water that they were purchasing. So this helped them have some information out there. There are over 14,000 hits on these projects that have been posted at the Wayne State website. In the interprofessional visits, you will be engaging with one of the largest group of interprofessionals from pharmacy, occupational therapy, nursing, physician assistants, social work, dentistry, with partners from the University of Detroit Mercy. In terms of the online assistance, we do have specific clinics for diabetes. We have specific clinics that our students are engaging in street medicine or in the returning citizens, which are persons that were incarcerated. You are going to be trained before you actually interact with the persons that have been that were incarcerated. And again, I want to thank you and allow my students to have an opportunity to share more with you.
So we have a number of medical students here who are involved in specific organizations, but they're going to share a little bit about their life as a medical student. So if we can start, I'm going to start with Ingina. If you could let us know what year you are, what you're involved in.
Hi, thank you so much, Dawn. My name is Gina. I'm currently an M2 here at Wayne. I'll be talking a bit more about student-run clinics. As was previously said in the previous slides, there are a lot of student-run clinics, but I'm going to focus more on Malta Dental and Medical Clinic because I'm the clinical coordinator for that group. So I'm just going to share my slides here for you guys. I'll be giving a brief history and rundown of the clinic in terms of like what we do and what Malta Clinic is all about. So I'll be talking about Malta Dental and Medical Clinic. It's located not too far from campus, around a 5 to 10-minute drive on Woodward. So the mission statement of Malta Clinic is basically to provide exceptional care, including dental, medical, and eye care free of charge without discrimination to uninsured residents of Metro Detroit area. A bit of background from Malta Clinic. So basically, Malta Dental and Medical Clinic was launched in 2004 by members of the Order of Malta, which is basically a Catholic religious organization. So the bishop who was in charge of this Catholic church, they were in the basement of a soup kitchen in St. Leo's Church, which is in a very poor neighborhood in Detroit. And he was moved by the patient population there. And he decided that in addition to servicing the soup kitchen, he believed that the patients there should also get free clinic and medical care. So the board of the Order of Malta decided to take on that challenge, I'm sorry, and organize the Malta Dental and Clinic in 2004. And we've been going strong ever since. So the clinic serves the poor and sick regardless of age, race, gender, religion, or ethnicity. In addition to providing healthcare, the clinic can now connect its patients to many services offered by the center, including counseling, free food, clothing, job recruitment, and other social services. And that's one thing I like about like Malta Clinic. In addition to the other clinics, student-run clinics at Wayne, it encompasses a lot more. It's not only medical, it's also, we have like a soup kitchen, which you guys will know about for like doing outreach hours where we work with Mercy Church as well for that. We have like an eye clinic as well for anyone who may be interested in ophthalmology and those stuff. It's not only medical. And even though we have like a dental portion, the dental and medical work in the same building. So sometimes if there's like a really cool patient who had an interesting case, we can just walk over to the other side and see dental cases as well, even though we're at Wayne, actually, you're mostly participating with the medical portion of the clinic. So the clinic basically has three goals. It's to provide patients with the care they need in order to improve their physical and mental and oral health. It's also to increase self-esteem and sociability to improve the patient's ability to gain employment. And also another goal for the clinic is to provide access to care in spite of being uninsured. So we serve uninsured and underserved populations. But also if patients do come and they have like Medicare or anything like that, we do refer them to the Medicaid clinic. So, as I said before, like a really unique thing about Malta is that we have not only the medical portion, but we have like a social service portion, a dental portion, an eye portion. And at Malta, we have volunteers from all over, actually, not only at Wayne, but you'll also get to connect and socialize with other students at these organizations at Wayne State, Detroit Mercy School of Dentistry, physicians from Beaumont and DMC. It's a great place to connect. So these are some of the services offered by Malta. For dental, they offer like examinations, x-rays, fill-ins, and cleanings. For the eye clinic, which is hosted last Tuesday of every month, we have eye examinations and we have prescription glasses for any patient who come in and may need that. All of these are free of charge for the patient. For the medical portion, which you guys would mostly be involved with, we offer to the patients of the community general clinic care, physical exam, blood pressure screening, and we give them free medication or supplies that they may need. These are just some statistics that I thought was pretty interesting to let you guys know what we're doing here at Malta. So in the year of 2021, from January to December, we saw like 1,900 patients. 262 were new patients. And since opening, the clinic has served over 20,000 uninsured and low-income patients of Detroit. For every dollar that's spent, the clinic provides 3 times the amount of services, making our volunteer-driven model a tremendous value. If you have any questions or would like to learn more about Malta, I've attached here the website and or an email address where you can reach out to us. Thank you.
Gina, why did you choose to serve in Malta?
Yes. So I chose to serve at Malta because it encompasses a lot of stuff that was.
You're muted.
Can you hear me now?
Yes.
Yes, so I decided to serve at Malta because it basically aligned with my personal passion and desire to serve a diverse patient population. I also like the uniqueness of Malta compared to like the other clinics here at Wayne in terms of like I could connect and like network with the dental portion or the eye portion. I know that some of the clinics free student-run clinics at Wayne didn't have like an eye or a dental care associated with it. So I thought that was like super unique. I would like have more opportunities to learn more and not just focus on like medical. I also learn about eye or dental, and I'll also have opportunities to we have like a soup kitchen where we do outreach hours. I also have that for like social care as well. So that was like one of the things that like drew me to Malta.
We're going to go on to Samantha, and I'll come back to Gina after we get through all the student presentations. Samantha.
Hi everyone, thank you for the introduction. I'm going to share my screen. It's just sort of a flyer that we share with all the students, prospective students, especially at our second look day when we have accepted students. So it's just a simple flyer that really, it really states what the mission is at Cass Coastea Clinic. So just to give you a little background about myself, I am a second year as well. I am an out-of-state student. I'm from Southern California. And I think the big thing when applying to medical schools is I knew I wanted to be a part of an urban community, similar to where I live back home. And I think that Wayne really sort of had that mission statement that aligned with mine as well, being able to work in a very diverse area and being able to essentially walk right out of school and know that I'm serving the community that I'm surrounded by. So similar to Gina, we know that there's a lot of student-run free clinic opportunities. The way you really find out about them is you get a ton of emails from different opportunities that you can sign up for. There's also a calendar that is sent out every week with all of the activities that you can participate in. Specifically, Cass Coastea Clinic caught my eye. One, because it was on a weekend. It's on a Saturday. We operate Saturdays from 9 to 12. So it's really great to be able to maybe focus on school for the week and then on the weekend be able to participate in a student-run free clinic that doesn't necessarily take time away from studying, because I know how important that is. So just to give you an idea of our mission statement, Cass Coastea Clinic is a free clinic dedicated to fulfilling the healthcare needs of the underserved population in Detroit by providing community members with free quality medical care and prescription medications, no insurance necessary. So it kind of shares the same sentiment as Malta Clinic. We do not discriminate in terms of insurance. The great thing about Cass Coastea Clinic is also that it is a walk-in clinic. So as you can see, this is sort of the setup we have right now. We are planning to move to a bigger space sometime in the end of August, which should really cater to a lot bigger patient population, because we will be placed next to a shelter, and it is a family shelter, so there will be a lot of families hopefully visiting our clinic soon. But as for now, the way that the clinic usually runs, just to give you an idea, the patient walks in, we check them in. They usually can see a care team right away, and a care team is composed usually of an M4 or a physician, an M2, and we do also allow undergrads. So it's a mix of all the different classes sort of sitting at one table. And that gives you a really great way to network, talk to M4s, talk to physicians, talk to people who are, in the medical field, if you're an undergrad or if you're an M1, sort of see how a care team works. It's really awesome. I definitely recommend, if you are also an undergrad right now or in your gap year, we are making a new program for undergrads. So make sure to look on our website within the next month, because we do allow for not only medical students to share in this activity, but also undergrad students. But just in general, after the patient sees the care team, we present to a physician. We always have a physician on staff as well as a nurse. They have both been there for a very long time, and they're very passionate about the clinic. Cass Coastea Clinic opened in 1981. The founder was Dr. Coastea, And it has grown a lot since then. We have 9 coordinators. I'm one of them. I'm the volunteer coordinator. So again, also, if you have any questions regarding Cass Costanza Clinic, the email is at the bottom right. And then this QR code is a link to our website. So yeah, some of the great things about Cass Costanza Clinic is we do partner with other smaller clinics within Wayne. So we partner with FreshRx, and they come to our location, and they essentially set patients up if they have any issues with food resources. They set them up with a gift card to be able to go to Eastern Market, which is sort of a farmer's market that we have here in Detroit, to be able to get fresh food. We also partner with social needs. So essentially, we have somebody on site that also talks to patients about any social determinants of health that they're facing, whether it's housing, other specific medical care they need, also food resources, and gives them ways to sort of combat those social determinants of health. We also partner with Site Savers. So they are also a student-run club and essentially allow for giving out glasses if necessary and eye exams. Another group we partner with is Lions Hearing. So they also administer hearing tests and things like that. So it's really great. It's a one-stop shop. That's what we like to call it. Dr. Hoffman is the physician on site with us, and he helps sort of guide us and teach us. He's a really great teacher. You can see a bunch of medical students presenting to him about the patient that they just saw, and he'll give you a whole spiel essentially about what it is real life being a physician, whether it's about, high blood pressure or diabetes, or like what type of medication they would need. He's really helpful with that. And we are able to give prescription medicine. So that's also really great for people who don't have insurance. We have a lot of returning patients as well. So you can build a lot of rapport with those patients, which is really great. And kind of see how they've grown since starting out at being at Cass Costanza Clinic. But that's the majority of what I would say are the great things about Cass Clinic. It's on a Saturday, which again, I want to emphasize is, I think in my opinion, one of the great things about it. And we are every Saturday, no matter what. We always have 2 coordinators on staff. So we kind of rotate who's there on each Saturday, which is really great. There's also always people there if you have questions or you're stuck or you're having a computer issue or anything like that. So you're not just sort of thrown in there and have no idea what to do. A lot of the things that students do, if let's say they're undergrad, if you decide you want to participate in this, or you're an M1 who just started, a lot of things you can do is what you're comfortable with. We do take vitals, of course. So taking vitals is one sort of big step that you can take to start getting in that clinical world. So we do a lot of opportunities for maybe people like undergrads who have no experience in the clinical field yet. So that's what I want to say about Cass Clinic.
Thanks, Samantha. We're going to go to Timothy, and then we're going to have time at the end to go ahead and bring all your questions and try to get them answered if we're not answering them in the chat. Timothy?
All right, thank you, Dawn. So yeah, my name is Timothy Page. I'm a second-year student at Wayne as well. And I'm here representing Site Savers, which is our mobile student-run clinic at Wayne that focuses specifically on providing ophthalmology or eye care to patients in Detroit. We provide completely free eye care for all patients that are under or uninsured. And so we're a mobile clinic. And so what that means is we go to various different student-run clinics. So as you know, Samantha was just talking about Cass Clinic, so we're there pretty often. We also go to Amigos Medicos, which is a clinic in Mexican Town in the southwest area of Detroit. And recently we started going to St. Pat's, which is a geriatric care center for the older population. A cool thing about our clinic is that it's all walk-ins. So we see everyone that we can that just walks in and needs some care. So just to give you like a quick overview of what we do, we work pretty much every Saturday from 9 to 12 or 10 to 1. It's about 3 hours each time. And we essentially provide just, the basic eye exam, looking at a Snellen chart, taking eye pressures, looking at extraocular movements and pupillary reflexes. It's a really great way to practice the skills that we learn in our clinical skills course at Wayne State. By the end of your first year, you will have all of these techniques down. And so it's a good opportunity to use those skills. And we provide care for a wide range of patients. So I can give an example of when we were at Cass Clinic a couple months ago. We had to provide like 15 eye exams for high school students that were doing a program at Wayne. But then we also will go to St. Pat's to work with the older population in Detroit. Also, when we work at Amigos Medicos, we get to work with predominantly Spanish-speaking population. So if you're a Spanish speaker, that's a really great way to use that skill. And so what we do we're mostly a screening clinic where we take an eye exam, get their visual acuity, and then refer them to Malta is a really common one that we refer to, or to other clinics locally for patients that do have insurance, because we don't have the tools to, make glasses, or we're not doctors, so we can't prescribe the medication. So we don't have a physician with us on staff, so that's why we often do have to refer, but we do fortunately have glasses that we often are able to provide patients that can provide a good improvement to their vision. And so in summary, it's a great way to serve the population of Detroit. Then it's also really good for students to learn and practice their skills in a real world setting. And you don't need to have an interest in ophthalmology to work with Sightsavers. Everybody's welcome. It's every Saturday from 9 to 12. And if you ever come to Wayne State, we'd love to see you there. And if you have any questions, let me know.
Thanks, Timothy. I'll do a real quick follow-up. When did you start working there, and how did you get trained?
Yeah, so that's a good question. I started working there during M1. We get sent out an email about once a week about different service opportunities for that week. And when I found out about Sightsavers, I was really drawn to it. I have an interest in ophthalmology, and as well as experience working in a volunteer setting for ophthalmology. And so the training is really, we teach the volunteers, for like 10 to 15 minutes before we open clinic. It's pretty quick, relatively easy training. But also in our clinical skills class at Wayne State, we do a full, we learn a lot of the ophthalmology clinical techniques that we use. So I would say both working at the clinic and then also in school have both helped prepare me for it.
All right. I am going to put a couple questions out there, and it may be Dr. Mendez or it may be one of the students that's going to be able to answer it. I don't think our other students have been able to join yet. So I'll go down here. Do you need specific language certifications to utilize the language you know in the clinics? Are any of you using other languages?
It's not a requirement, but it's a preference. So we do encourage you as part of your outreach hours to engage in the language courses. So we do have Spanish, Arabic, and Mandarin at the moment. We also have sign language.
Okay. Great. So we have a student, Dr. Mendez, who's a nurse practitioner. Would she volunteer at the clinic in her scope as that license, or would she be acting as a level 1 while in M1 or M2?
For credit for the course, she would be engaging as a M1 or an M2 because we do not have access to her license.
Thank you. Samantha, how did you decide to go to Cass Clinic?
Definitely. So I did look at sort of all the clinics available. Like I said, one thing that drew me was it was on Saturday. But another thing is I really just kind of picked one, to be honest, to kind of see. It was also close to where I live, and I don't have a car currently. since I am from out of state. So it was just a walk away. It's a couple blocks from where I live, which is super close to Wayne State School of Medicine. So those were two sort of physical things, I would say, that were really drew me to CAS. But once I volunteered there once, the really big things that drew me were that it was very student driven. Like I said, the care teams are mostly medical students, but we also have, you know, the supervising physician and the nurse. If we have any questions, they're, you know, always there to answer. So those were the major draws for me to continue with CAS Clinic once I started.
So
Don, I'd
CAS
like to
Clinic is
answer a question regarding the returning citizens, because that's a justice issue and it's one of our missions of Wayne State. So I think it was trying to remember who asked that. Shana, I think. Shana, the returning citizens, we work with the Department of Correctionals. They provide our students the background on the persons that were incarcerated. They provide the persons that were incarcerated our information. The clinic that we use, or I should say, community site that we have our clinic in, is where they come to get food, specifically groceries. So we offer our clinic the day they come for groceries. That way, we're not having to go to homes, but we're actually engaging with the patients at a site that they're more comfortable being at. I hope I answered your question, Sean.
great. What is something?
Mule, I think, asked a question regarding how student clinics are run. Yes, they are under the supervision of a physician. The physician is the one that holds the license for those clinics, and they are responsible for the students in those clinics. Our students are not licensed practitioners. They're called physicians in training. And
All
I
right,
think
so I'm going
Jack,
to ask all the questions.
one. So Jack, regarding the Chinese language, yes, minimum is fine. Thank you. Done.
All right. So Daniel was asking the questions for the students. What are the most rewarding aspects of these clinics in terms of training experience and advice from physicians? So Gina?
Yes, I can take that question or answer that question. I think one of the most rewarding experience being in the clinic is that basically it has taught me like invaluable lessons on empathy, cultural competency, and adaptability. Also, being in clinic has also like inspired me to advocate more for health equity. And as a physician in training, it helps me to like strive for more innovative solutions to improve healthcare and outcome for all. Because my goal as a physician is to be a culturally competent physician who serves all patients, regardless of their ethnic background or financial, ethnic or financial backgrounds. Also, it's really great because in year one and year two, it's kind of like your didactic years. So you can basically apply the book knowledge that you've learned in classes to patients in clinics. We have a course called Clinical Skills where we learn how to do physical exams, take blood pressure, do vitals, and we practice in clinical skills, but then we have like real life experiences as well, which is really good because clinical skills is kind of like, I guess it's more like strict and under control versus like you get real life world experiences when you're in clinics. I think that's really great. Also, networking with the physicians, they give you like invaluable advices of residency, specialties, like anything that you need to know, and you can develop like mentorship with the physicians in these clinics.
Samantha, can I quickly ask you? I know you're involved with CAS and you said it was important for you, CAS Costeo Clinic. I know it's very important for you to, as you said, have that balance by every Saturday and being able to focus on work. Are there other activities that you're involved in besides the clinic?
Yes, I am. So I have an interest in pursuing general surgery as a specialty. So I'm one of the coordinators for the general surgery interest group. I'm also on a committee for Detroit Schools for Public Health. So It essentially integrates my past involvement in sports, where we sort of are on site medical aid for maybe students who get hurt on the field. So kind of, I know there's a lot of sort of there's a low amount of physicians and maybe physical aides that are able to be on site for sport events, especially in Detroit. And seeing that, I was made myself involved in those types of things, especially since they involve sports. I'm also involved on the LMSA mentorship chair, which is the Latin American Student Association. I come from a Hispanic heritage, so I knew that was important for me to pursue also in medical school. I'm also a peer mentor, so I do mentor a group of about 16 M1 students, and I just started being a near peer tutor. So essentially, in one of the classes, it's called evidence-based medicine. I am sort of there to help and guide students through the different activities once a month.
Thank you. Timothy, I know that being with Sight Savers isn't necessarily, connecting with physicians. Do you have other opportunities besides Sight Savers to do that?
Yeah, I mean, there's definitely, I think Kristen mentioned in the beginning, there's a lot of like research opportunities that I've been able to engage in to get to know some physicians better, especially in the field that I'm interested in applying to. And Wayne State at the beginning of M1 and M2, I know there's like the research elective, as well as several other electives that really kind of get you under one of the faculty's wings. And then there's also a ton of shadowing opportunities that I know people, especially the doctors in the DMC system, are very available and want to make themselves available for Wayne State students that show interest. And then I'm also part of another organization called Aqueducts. That's like we're basically trying to provide, we're trying to provide basically swimming lessons and like water safety to the patients, or not to patients, but to people in Detroit. So we've been working with one of the doctors at Wayne with that too. So.
One of the things that I can, share with you is we are presenting this session really truly on just the student-run free clinics. As Kristen said, there are hundreds, over 100 student organizations that students are involved in. And as you can see, many of them are involved in more than one organization. These just happen to be the ones that we focused on for this webinar. Because otherwise it could take us many hours if we let you hear from everyone that's involved. I am going to, I know Dr. Mendez knows a little bit about Do Clinic.
I was just going to respond to Danielle about that, so I'll go ahead. So Danielle, at the diabetes clinic, the patients are recruited from our current patients at the Detroit Receiving Hospital, or from some of the student-run clinics like CAS or others. When they come to that clinic, it's mostly education, how specifically diet, because we work with the nutrition students. We also have the pharmacy students. We have social work students and occupational therapy students. This allows the patient to have a more all-rounded experience rather than just meeting with medicine. Daniel, if you have another question related to that, please put it in the chat. Thank you.
Were any of you nervous when you thought about going into a clinic as an M1 student and not sure what to expect, or were you trained ahead of time?
I can start that question off. I think, yes, I was nervous initially about going into a clinic, but I feel like since we had that clinical skills course that taught us how to do like patient interviewing, getting patient history, doing the vitals, checking the blood pressure, it kind of like calmed my nerves down a little bit. And at Malta, before you see a patient, you'll get a rundown of like how the clinic works and like what's expected of you. So that kind of helped as well before starting volunteering at the clinics.
Samantha, how about you?
Definitely intimidating. I didn't come from a background of a lot of clinical experience as an undergrad. So walking into a clinic, not being trained beforehand was a little intimidating, but I think just knowing that you're going to be with people who have been in your shoes at some point really helps, especially because I was working with M3s and M4s. They were an M1 at some point, right? So they kind of took me under their wing, and they're all of the people I've met at Wayne, whether alumni or current students, they're all very welcoming, and they all know what it is to be a medical student at some point, especially like I said, in my shoes. So I think within a couple minutes, that sort of worry was taken away, especially when, they asked me if I felt comfortable. Do you feel comfortable taking a blood pressure, for example? And I said, maybe not the first time, right? So they'd be like, okay, let me show you. And they would kind of do the see one, do one, teach one, which really helps. And that's a lot of what, learning medicine and learning how to take a blood pressure, how to, listen to heart sounds, things like that, really helps when you have like a mentor, especially like an upperclassman, show you.
Dr. Mendez, I'm going to put this one to you. How does Wayne State University School of Medicine get information out to prospective patients about
Just typing that to Angeline. So we have a River Walkers program that starts every June through August at the Detroit Riverfront. There are 7,000 walkers that show up. Our students are there every Tuesday morning from 7:45 a.m. to 9:45 a.m. They take blood pressures of the patients, and they advise them about our other clinics like gas clinics, street medicine, diabetes, Corktown for LGBT. So there are opportunities that are done through the River Walkers program. However, most of the churches in the city are aware of the student-run clinics. An example, Cass Clinic is also more than just a student-run clinic. It is a community clinic. So Malta is a community clinic. So when people come there for food or they come there for other services, they are then told, if you come back on Saturday, you're able to get free service from the students, because some of them are required to have Medicaid or Medicare in order to get the reimbursement for those clinics.
Tim, how did you get, do you have a leadership role with Sight Savers? I forgot to ask.
Yeah, I'm one of the coordinators.
And how did you get that role? Was there a nomination process? How did that happen?
Yeah. So there's in a few months into your first year, like we have all of the student organizations, they sent out an email that the new board needs to be selected. And so for me, I had already volunteered there once or twice, and then I had put in an application, and the previous board, the previous coordinators, they then select your application, you do a quick interview, and yeah, I ended up getting the role, fortunately. So
great. How about you, Samantha?
Similar to Timothy, they send out a pretty extensive list of all the orgs, which is really great. You don't have to sort of look for different types of things, especially I know how it is like an undergrad. That's how it feels like. So it's really great that there's sort of one spreadsheet that shows all of the application links. You click on the link. It's usually really short, asking essentially why you would like to be in a leadership role. They ask you to show for an interview. You do the interview with the past coordinators, and then you are selected after that.
And what is your responsibility as a coordinator?
So I specifically am the volunteer coordinator. Like I said, for Cass Clinic, we have about 9 coordinators because we do have a lot of different moving parts. As the volunteer coordinator, I manage the undergrad sign up as well as the medical student sign up. So that's mostly my role, especially sending out emails, making sure that all the volunteers who signed up have showed up. and cross-referencing, as well as approving service hours for people that need it as well.
Dr. Mendez, are there any clinics that focus on mental health and
Yes,
resources?
we do some of that in our schools. So when our students are doing tutoring at some of the public schools, they do offer the opportunity for those students who might need mental health to engage with our students one-on-one. A lot of times, mental health issues, people are not willing to speak about it publicly. So when they get this opportunity to have a one-on-one engagement, it is much more appealing to them. We have a similar thing with the senior centers. So example, when Timothy was talking about St. Pat's, we do have the opportunity for some privacy there to talk to the patient directly.
Dr. Mendez, this is a little bit more. The PhD students, when they're in their graduate years, are they still working with these different organizations?
Yes, I was going to answer that question just now in the chat. The MD PhD students in year 2 are in that program specifically doing more research, so there's little less time for them to engage in the clinics. However, they're not discouraged from coming. They can come and participate in any of the clinics. Most of them come back after they finish their MD PhD courses back into the med school curriculum and are part of the program. But I see many of them during the regular clinics. We actually have a program that I'm waiting to get approved from the provost. It's called Empower Science Detroit, where the graduate students, MD, PhD students, are going to go out into the schools to specifically discuss careers in science and how it relates to them if they decide to become physicians. So I'm just waiting to get the approval for that.
All right. One of the questions was, are there opportunities for students to organize and establish new clinics?
100% yes. 100% yes. The returning citizens was something that I saw was a need, and I talked to a couple of our year ones who are now year 2 students, and very much was their initiatives in terms of going out and advocating with the Department of Correctionals in order for us to start that program. Street Run was the same way. We had a student from Canada who wanted to engage with the population that is on houseless, and that was how we got started.
And he's still talking to undergrad students now.
Oh,
that
he does.
Back in Canada.
Oh, yes, he does.
Frequently from students that said, oh, I talked to Dr. Wong and he said he started this program. So yes, that's how that started.
100% our alumni, as Ms. Copenhagen said, our alumni are very engaged with our students. So anytime you feel that you have an idea and you don't think you are as able to, with experience, to start something, please reach out, talk to me, talk to our alumni. We'll work with you. I know there was a question about whether specific programs, I think Shoshana had asked about children versus adults. Many of the clinics have families, so they can see either children or adults, but there are some clinics that are pediatrics focused, so you would be engaging with those.
And Joey asked a question about opioid abuse and overdose and Narcan.
Yes. So the students that engage with our HIV program also get an experience with overdose. And it's done. They have to do the modules with Michigan Department of Community Health. There are, I think, 5 modules, and they get a certification from that in order to engage. Those are in addition to their regular classwork, if somebody's interested in that.
So
I know there's been a number of questions regarding research and clinics. Specifically, our students are engaging with service related to patient needs. Research is a part of it, but it's not a focus of the clinic. So, example, if there is something related to a specific research project, it does happen outside of the clinic. Like we have the diabetes clinic, the students meet on Monday afternoons regarding their research projects.
Timothy, what do you hope incoming students are going to bring to Site Savers to make it more efficient, more robust, anything along that line? Do you have any thoughts on that?
For incoming students to make it better?
Yeah.
Or to
Yep.
I mean, I think, I don't know, I feel like with a lot of these clinics, at least what like M1s can bring is just like, I don't know, general enthusiasm to learn and want to provide care. You know, there's only so much that you can bring in as an M1, especially your first time. I know for me, like even though I had experience working in a clinic before, like I had in undergrad, like that it can only take you so far. But I had a really strong enthusiasm about improving and learning how to serve patients, and I think really just willingness to learn from your peers, from the physicians, and also to learn from the patients too. There's a lot of great insight from patients that they'll give you feedback on, and so I would just say like willingness to learn and grow, and I think that's probably the best thing for incoming students. And it improves the clinics for sure.
I want to add to what Timothy is saying. Dr. Anju Goyal is our lead for the Site Savers, and she does offer you the opportunities, not only research, but in year 3 and 4 to engage in some of her clinics where she sees more patients with more needs.
Oh, okay. So that's just kind of an extension of their weekly responsibilities with Site Savers.
Correct.
And what about health education workshop? I think, Dr. Mendez, you talked a little bit.
Yeah, and let me just go back to that. So as part of year 1 and 2, your curriculum is 35 hours within the service learning course. And we have 3 segments, A, B, C. So in A, you have an opportunity, example, the class of 2028 right now is engaging with the health department zip code needs in that specific health zone. What are the needs of those patients so that when they are applying to become a student-run clinic, they're very well aware of what the requirements of the community are and not just continuing what the previous class had done. So that's an opportunity for them to get better educated. In terms of the class of 2027, segment 2C, they are engaging with the interprofessional team visits with other disciplines. So every segment, we have a different focus for our students. So I don't know if Gina or Sam or Tim want to comment, but in segment 1C, they had some deliberate practice opportunities. Maybe you want to talk a little bit about that? Any one of you? With your ultrasound components as part of service learning. I don't know if they're frozen, but okay, I'll explain. So in segment 1C, they had a case that they had to use visual thinking and ultrasound in order to understand the patient better about that case. So we're taking what they're learning in the clinical skills, P4, and service learning and combining it. Gina, you're going to respond to that, so go ahead.
No, I don't have anything to add on. I'm sorry. You said the ultrasound with the tie it into the clinical aspect of service learning. Sorry.
Right. We are at time. So I want to thank everyone who joined us. We had a great group of participants. We loved all your questions. We will post this webinar. It will be on our website. And hopefully within about a week, maybe 2 weeks, just kind of keep an eye on it. We try to do these webinars. So The next one, I'm not sure, Derek, if you know what the next on-ramp series is. He's not, yep, there he is.
To be determined, but stay tuned because they're always good.
Okay, thank you. Because we have we just started last week. Our M1 students started July 1st. So they're just learning the ropes and getting involved in organizations. So hopefully you'll join us for more. We'll be sending out emails, watch our website, admissions, med.wayne.edu. Thank you very much.